Hello, my name's Tony Bukta. I'm the owner of Central Ohio Compounding Pharmacy. We're located in Columbus, Ohio. And I'm here today with my good friend, John Herr. John's a compounding pharmacist that owns Town & Country Compounding Pharmacy in Ramsey, New Jersey. We've been in practice for over 25 years, and one area of specialty we have is men's health. And that's what we're going to talk about today. In particular, the journey that men have to travel dealing with erectile dysfunction. Erectile dysfunction is very common, often not talked about, and it should be. It can happen for a variety of reasons. It could be as a result of disease, medication therapy, possibly a result of a surgery, or just natural aging. But there's a lot of treatment options out there to address these problems. We're looking forward to working with you and your physician to customize your personalized care so we can help you achieve your results that you're looking for.
So Tony, I imagine just like you owning a compounding pharmacy that's involved in wellness and trying to maintain health, you get lots of questions from your female customers, but do you tend to get a lot of questions from your male customers?
You know, not as many as I think we should, but we do get a good number. A lot of times, to be honest, it's the women that are bringing their husbands to us. And then that gives us the opening to talk about whatever it is their challenge is. And to be honest, most of the guys who are coming to us, it's about erectile dysfunction. And they're really focused on that, but it's really a symptom of a lot of other things that are going on.
That's a good point, because many men don't realize, but the first symptom of heart disease or cardiac disease is erectile dysfunction.
Yeah.
And by then, it's too late. So as integrative pharmacies, we try to help men to maintain health. Like I always say that in the United States, we say we're in healthcare, but in reality, we're in sick care. Our system is set up so that when, you have a disease, you go to your doctor, and then he or she prescribes, a medication for your high blood pressure or your heart disease or your elevated cholesterol. And as integrative pharmacies, we both try and believe in practicing the maintaining of health and wellness. Do you agree?
Yeah, I agree. It's so much of it is about prevention and making choices early on so you don't end up with those disease conditions later in life that you have to deal with. And I think one of those foundational things is the use of supplements. Once we put back, what the body needs, it can take care of itself and function at a high level. And I think we really focus on key nutrients like magnesium. I think you need that for over 250 metabolic processes, and we just don't get it from our diet. So food isn't always the source. A healthy diet's important, but I think using the right supplements really is key to optimizing your function.
Yeah, I agree. Almost every patient I see should be on an additional dose of magnesium, and particularly the men too. A product like this by Zymogen, Prostate Flow, kind of maintains a healthy prostate. So again, you don't get into these problems where later on in life, the doctor has you on medication so that you can urinate.
Yeah, and I think that's exactly right, John. And as we're talking about men and erectile dysfunction, is nitric oxide. I think, that is a very important supplement. It's a critical gas in our body that causes vasodilation. So as you touched on earlier, the heart's a huge vascular muscle. And if we can open up those arteries to improve blood flow, you're going to get better blood delivery to your brain, to all of your organs, and ultimately to your penile organ, so you get a better response with erectile dysfunction.
Yeah, that reminds me of a story. I had a patient who was referred to me for a consult, and he was using Viagra like most men, and it just wasn't working as well as it used to. So you're right, we recommended the nitric oxide, but we also had this, and I know you recommend a lot of this too, but it's a little test strip. We have them here at the pharmacy, and we also have little like test packs that you can order and we can ship to you. But this actually tests your nitric oxide level. So this gentleman, he was in the pharmacy, he tested his level, and you look at a color change, it takes 15 seconds, and he had really no NO in his body. He started on the supplement, and lo and behold, he contacted me like a month later, and his Viagra is working again. But then the surprising part of the story is then 2 months later, he told me that he went back to his family practice physician, and he actually decreased one of his cardiac medications and took him off of one of his blood pressure medications. Yeah. So not only did the Viagra work like it was supposed to, but it actually improved his health and his chances of living a long, healthy life without heart disease.
And I think these type of tools or diagnostics are so helpful because you can visually see where you're at. And we try to get every patient who comes in with an erectile problem to do a test. And inevitably, they'll walk out with the nitric oxide because you can see it and you start to see how it works real quickly. You get some good improvements there.
And speaking of tests, what about that saliva test that we have there? I know a lot of men will go to their physician and they can draw their blood to see where their free and total testosterone level is, but there's other benefits to using the saliva test.
Yeah, so saliva testing has been around for over 25 years, and it's a very effective way to measure your hormone levels in the comfort of your own home. So we can use these tests to measure your testosterone, your cortisol, a variety of hormones that impact your health. And you can do it, we can mail you the kit. You can do it in the comfort of your home. You can pack it up, you ship it off to be processed, and then you'll get a copy of the results as well as the pharmacy. And then we can then help interpret that and work with you and your physician to see what your needs are. Testosterone is a big part of that, but also we need to look at your cortisol levels. We want to see where that is well, because that'll shut everything down if your cortisol is real high. John, you want to talk a little bit about the different ways we can administer testosterone?
Oh, sure. And when you mentioned cortisol, we really know that cortisol can lead to inflammation, and inflammation is just really the beginning of most of the chronic diseases we see in our country. You could go to your physician, you can get a testosterone injection. That's very common. Sometimes it can be injected once a week, once every 2 weeks. The disadvantage is that it's an intramuscular injection, so it's more difficult for the patient to do at home. What we like to do in both of our pharmacies is use testosterone transdermally or topically. So this is a Topiclick device. So here's two different size devices. They are, just deliver different amounts. And the gentleman can easily just open the top. You click it to prime it when you first get it, and then you will see, after it's primed, the number of clicks equates to the dose of testosterone that's been prescribed. So I'll say my dose is 2 clicks. I have my 2 clicks there. Then with the applicator, you can apply it to the skin. It's usually used once a day. It's typically used in the morning. We usually recommend to our patients to use it up on the shoulder. They can rub it up in the shoulder after showering, wash their hands good. With this device, you don't really have to touch it, which is nice. But if you do touch it, you want to wash your hands so you don't get any transference to other patients or children or pets. But this is something that will raise that testosterone level. And the thing that we always caution is testosterone is very good. It's good for cardiac health. It's good for your mental well-being. It's good for your muscle tone. You're not getting that abdominal weight gain that we see as we age. But a lot of men think that this is what's going to give them an erection. Well, I'm sure you get that. What do you tell them?
Exactly. We hear that a lot. This is really the hormone of desire. It's going to restore your drive, your want to, but it's not going to improve your erection. And how do we treat their erectile dysfunction? And that's when we're going to go. We'll first start with oral medications. The common ones that people have heard of, Viagra, Cialis. Those are usually the first place we'll start. We can use those type of drugs and incorporate that into a lozenger. One of the real advantage of using this therapy is that it's absorbed quickly. It's just dissolved in your, under your tongue, in your cheek. You can usually use a smaller effective dose. You don't have as many side effects, but more importantly, the onset is much quicker, usually 1/4 of the time as it would take if you had taken an oral medication. And then food doesn't come into play. If you've had a full meal and you've taken an oral medication, it's going to really delay the onset and probably diminish the effectiveness. When you do it with a sublingual lozenge, it bypasses all of that. So you still get the response in a very rapid form, and you'll get a good outcome.
Yeah, it's a good point, Tony, because I know a lot of couples, say, for example, they have a date night. They're going to go out. What are they going to do? They have a big meal. So then you have a big meal and you go to take your Viagra or Cialis, and it's just not going to work as effectively. And I often also mention to the men that I like, even if you're taking it in the lozenge or the tablet form, to take it in conjunction, like I mentioned earlier, with that nitric oxide support. I really find that's what really helps it work a little better. Yeah. But then as we go through this journey as a man, things change. Everything doesn't remain the same. So I guess you have the same question that we see, where some men say, look, it's just not working like it used to work. It's not working when I take it with the nitric oxide support. Now, I still recommend taking it with the nitric oxide support because, like we mentioned, it's good for your cardiac health. But here's where you could use a mechanical device. This is an example of a vacuum erection pump that can be used in conjunction with these medications we've seen. And a lot of the men just find that when they use that, it does, again, helps them obtain and maintain an erection that's suitable for intercourse.
We can then look at penile injections. Those are typically referred to as a trimix or a quad mix. And those are medications that will cause vasodilation in the penis directly. They're very effective, as referred to in some of the other training videos we've done, onset of about 5 to 10 minutes. It gives you one more option. If you get to a point where that's no longer working, then there's other options, aren't there?
Yeah, because we see men, maybe because of surgery due to cancer or whatnot, where the prostate was removed. Some men will find that the trimix or the penile injection will be effective. Others, it just isn't. Or they may have a condition known as venous leakage. So even though the blood will flow into the penis, because of the leakage, it's not able to be maintained there. There is something that a lot of men aren't aware of. It's a penile implant, and it has a pump. It's all implanted in the body. It's made by Boston Scientific. And it is that last route that a man can go if, he still is trying to, obtain and maintain an erection, and he's gone through all the other things that we've discussed.
I think we covered a lot of things here around erectile dysfunction, but ultimately it is such a vital part of a man's life that we want to have promoted that and help him on that journey to really achieve wellness. And it's not just the medications for erections alone. As we talked about earlier, it's a holistic approach to what can we do to help prevent the progression of disease and promote a healthy lifestyle.
Yeah, it's a good point, because a lot of the men, too, that are referred to us to discuss their problems. As a pharmacist, we can go through their medications. There are many medications that cause ED. We will never tell a man to stop a medication, but we can make suggestions that he can go back to his physician and discuss with them. We can maybe make a suggestion, well, this is the condition that you have, but we know you're suffering ED. This medication can add to that, so maybe you can speak to your physician about switching to another medication. And oftentimes, there's so many different types of medicine out there, and everybody's a specialist. They're not thinking of how what they prescribe could affect another area of the body. So as a compounding pharmacy that's versed and very interested in maintaining health and wellness, we can kind of help quarterback that with you.